Dr. Octo, reality of healthcare. August 1st to 8th imekuwa World Breastfeeding Week. But there are those questions that my fans have been asking me and none of you amewajibu. Let's go. Anonymous anauliza, Hi daktari, I have a 3-month-old baby but the father has a fetish of sucking my breasts. During foreplay before sex, can this affect my baby? Wa. We listen but we don't judge. So this one happens a lot. In fact, some of my friends or some of the people I interact with have said that they never knew that their sexual partner was actually breastfeeding until they sucked their breast and they felt some sour taste coming from the breast. But that's aside. Now, this question inatuleta kwa partners' behavior affecting baby's milk supply. Partners' behavior such as sucking the breasts of the mother, which is a fetish during foreplay before intercourse, can actually affect the supply demand of the breast milk. Number one, on the positive side, the more you empty your breast, the more milk is produced. So if the partner is sucking it, we guarantee that more milk will be produced. But this one can be dangerous if the partner is sucking more than is produced and if the baby is growing faster during the growth spurts. It then means that the baby is not going to get enough breast milk. And this one is a red flag. Number two, there's a risk of infection. The partner can actually transmit the infection to the baby via the same breast that he or she is sucking. Now, if the partner has cold sores or those things that zinafura hapa, hiyo yenye mnaita malaria, yenye nakujanga na flu, that is herpes simplex virus. The baby can easily get it from the nipples. If the partner has oral thrush or any other bacterial oral infection, H. pylori included, those ones can be transmitted by sucking the mother's breast. Again, kuna nipple trauma. You see, the force that the adult sucks the breast is different from the force that the infant actually sucks. Wanaume wananyonya hii matiti ni kama kuna kesho. But now mtoto is gentle on it if they're sucking it the right way. So nipple trauma inaweza leta cracks, yenye inaweza leta infection baadaye kama mastitis, and this one can be very uncomfortable to the mother. Hatajua what to do. The baby will not be breastfeeding comfortably. Now this one is actually cultural. There are cultural issues and some places there are taboos, other places wanaziacha tu zinaenda hivyo. So we don't judge, we listen but we don't judge. We just advise those couple, my fan here, to seek couple counseling if that one is affecting the baby's growth. Now, another fan of mine here anauliza, Daktari, niko HIV positive and I'm using ARVs. And I'm delivering this month. Should I be worried that my child will get HIV when I breastfeed? Breastfeeding is highly recommended if you're HIV positive, especially kama unatumia ARVs and your viral load is suppressed, CD4 cells ziko vile zinafaa zikuwe. This one makes the transmission much more difficult through breast milk. Although if your viral load is high, then unaweza transmit this infection. In fact, it's recommended that ukiwa HIV positive and you are using ARVs, the way my fan is doing here, you breastfeed continuously for 6 months, exclusive. Usipeane maji, usipeane juice, usipeane mawawau kwa mtoto, sijui nini. No, exclusive breastfeeding, because mixed feeding can actually carry a higher transmission risk of HIV to that child. And again, one of the things that is done after a child born to a HIV positive mother, one of the things we do in a hospital setting is that we will offer this child prophylaxis antiretrovirals ndio asienda apate HIV from any other source. And then we do serial testing until this child maybe around 2 years of age. Na tukiona mtoto ako tu sawa, then we continue. In case the child develops HIV in the course of breastfeeding or in the course of care, then we are going to give the appropriate antiretroviral medications. Okay. Now, if you're that man who sucks the lady's breast na kukuwe na cracked nipples, of course this one is going to make that child or that baby more likely kupata HIV. Any wound inaweza ama any break in skin barrier ina increase that risk ya kupata HIV. So this one I would just advise you confirm your viral load with your clinic na uende clinic wakuguide better, but ukiteka ARVs there's less chance of transmitting HIV through breast milk. Number 3, this one is kind of funny, but huyu fan anasema hivi, Dr. Octo, enjoy your content. Oh God, thank you. Feature ID nyuma ya tent. Kwa pia ID turushe nyuma ya tent. Tumerusha ID nyuma ya tent. I'm gay. Ameanza hivyo. I'm gay and someone told me that we can adopt a baby and start breastfeeding the baby. Can a man breastfeed a baby? How do other couples, wenye ni man and woman, who have adopted a child, how do they breastfeed or what do they do? So this one comes under the topic inducing breastfeeding, especially during adoption or in gay couples or lesbian couples. Let's say it so. But wacha tuangalie generally, ukiadopt mtoto, can you really breastfeed? So you're a mom, you're not able to conceive, you've adopted a baby, are you able to breastfeed? The answer is yes. Number 1, kuna kitu inaitwa hormonal priming. Actually, before you adopt that child, the doctors will put you on different hormones. One of them ni Depo-Provera yenye wamama wanadunga every 3 months, or unaweza on oral progesterone ama estrogen. At the same time, unawekwa on milk secreting medications kama domperidone ama metoclopramide. Hizo madawa zinatumika ku prevent nausea and vomiting na pia zinatumika kama mama hana maziwa. And this one is done before you adopt that child. Then when you are almost starting to breastfeed, they'll stop using these medications abruptly, and that one will mimic that abrupt drop in hormones when a child is born, and this one will stimulate prolactin, and prolactin will stimulate now milk letdown. Hapo utakuwa umekuwa ready ku breastfeed. Now that one is for a female patient. I'm a female gay couples, okay, or female lesbians. What happens if now this guy is gay? Is a man who needs to breastfeed. This one is a bit difficult, and to be realistic, of course, these people exist within us and we don't judge, and we are facing multiple or complex challenges nowadays when we are addressing them. Because again, wanajificha, because the law, ukipatikana wewe ni gay, sijui mara umepelekwa jela, si hatutafurahi huko ukiwa jela anyway, as a by the way. Now, for a gay couple, for a man to produce breast milk, it means inafaa undergo what is called a gender affirming care, ama gender reassignment. And this means that, because us men tuko na a lot of androgens, for you to be ukwe kama lady, I mean, wataanza kukudunga ma hormones, ma progesterone, estrogen, so that your body changes, even your breast tissue changes to that of a female. And this one is done way before you even think of adopting a child. If, for my fun, if your partner has undergone gender affirming care and all those things, then wataanza kumstimulate na this milk secreting medications. Of course, that one needs a fertility specialist. Don't just go into a normal doctor and expect that one to be carried out. You have to visit a fertility specialist. Now, if this man is not pursuing any hormonal therapy, then there's no medication to actually induce that lactation. But both of you can be involved in fully feeding the baby. Siku hizi kuna donor milk, kuna donors wana donate maziwa, and then you can supplement this by naan or any other thing, skin to skin care, okay? Kulach, kubond, unaweza jiranganisha umeweka kwa matiti yako, hata kama mtoto atasikia maziwa ikitoka. But the goal here ni you need a reproductive endocrinologist or a gender affirming care clinic, yeah, that I don't know if we have in Kenya. Probably that's something that should start because the world is changing. Now, I hope I've answered your story adoption. Now, another fan was here asking that, anasema the neighbor's child died at 3 months old, lakini yeye ana maziwa but ako na mtoto. Can my child breastfeed my neighbor who still has milk? In short, huyu fan anauliza, can someone else breastfeed my baby if I don't have milk? Or if I don't want to breastfeed, maybe my boobs are going to sag. That's what most women nowadays say. They want it to be pointed. Wanataka ikue pointi hivi, wataki ilale. This one is called wet nursing. Okay? Na imekuwa ikifanyika a lot in our culture. But ideally, before you take your child to that neighbor to breastfeed, that surrogate breastfeeding or tuseme the neighbor should actually undergo health screening for things like, they should be tested for diseases like HIV, hepatitis B. These are viruses that can easily pass through body fluids. And this one is worth arranging for a clinic kama ajui status yake, so that your child won't get any other infections from someone else. Now, another thing ni, even after your neighbor lost the child, I mean, the breast can still produce milk if they're stimulated. So yes, it's still possible when they're supplemented with medication or breast pump or any other form of nipple stimulation. But unajua, this one will lead to some very funny emotional dimensions. Yeah, maybe you won't probably bond with your child better. The neighbor will bond with your child much better, na inaweza muamshia that bereavement juu already ashapoteza mtoto wake. So this one can cause some psychological trauma to both of you if you're not careful. However, kuna other lower commitment alternatives, kama she could just pump that breast milk na kupe unyonyeshe upe mtoto wako through bottle feeding or breast pump, something like that. Or you can nurse them directly. Maybe your neighbor can just nurse them, but trust me, this one can bring problems hapo mbele, because mtoto atabond na mse anamnyonyesha tu, si hata unajua hivyo. Yeah. Kitu ingine ya mwisho, kuna fan hapa ameuliza tu generally, she has friends who actually abuse drugs and illicit substances like cocaine, heroin, cannabis, na pia anatumia pombe. Lakini ubeshte yake amejifungua. Sasa anauliza on behalf of beshte yake, naweza breastfeed mtoto despite mimi kutumia hizi miadarati zote? Okay? The answer is no. No. Cocaine iko na higher concentration in milk, itaenda kwa mtoi. Heroin, bangi ama cannabis, zote zitaenda kwa mtoto. Hizo zote. So what should actually be done? Na pia tuwezi sema ati tutakuwa na pump breast milk ndo zitoe hizo toxins alafu pe mtoto. No, it's not practical. Something like cannabis can stay in the body for up to 42 days, 6 weeks. Body jaenda. So you can't pump all the breast milk ati iende tu hivyo itoe hiyo cannabis. Actually, what you should do is actually, if you can avoid taking those illicit substances, please do. But I know it's very hard for people who are already hooked in that. Kuacha hizo substances ni ngumu, unahitaji rehab and that. So this is a child that you might need to just give formula milk, ama kama unaweza pata someone who has donated their breast milk for you to breastfeed them, then it will be okay. Now, this topic is very important, and we have addressed some things that people don't touch about. Adoption, gay couples, HIV and infection, substance abuse. What is the legal policy and legal framework in Kenya on breastfeeding? Number one, tuko na Breast Milk Substitute Regulation and Control Act of 2012. Ina regulate marketing of formula and feeding bottles to protect babies. Na hii inalign na WHO requirements. Yenye nasema, by all means, breast milk is the best milk for the baby. If you can't have it, or if you can't breastfeed your baby, kuna safe alternative ya formulas. And me and you know that kumekuwa na a lot of controversies in very reputable companies yenye wanatengeneza naan. Some of them wanasema hizi naan ziko na bacteria zina cause infection. Some of them sijui zinafanyia nini mtoto. And also naan is expensive. You can use up to 2 naans in a week or 2 depending on vile mtoto na breastfeed, and that one costs more than 5k in a week kununua tu naan. Kuna pia Employment Act of 2007 inasema mothers are now given maternity leave na 2 weeks of paternity leave for the fathers, na pia ina encourage workplaces ku encourage breastfeeding ama kupeana safe space ya breastfeeding. What other employers actually do, which is very good, if you're still breastfeeding up to 6 months, wanakupea 1 hour off every day as a break ya kubreastfeed, whether unataka mbutaki, wewe ndio unyonyeshe. By the it's your duty. Okay? And then kuna pia na kada yenye na control these illegal substances, and because these illegal substances can actually interfere with the quality of life ya mtoto kimbreastfeed hizi kimbreastfeed milk yenye contaminated na those illicit substances. To crown it, ama to finish this, if you're breastfeeding and you are taking some medications, ujue not all medications are safe in breastfeeding. Ujue not all foods, drinks are safe in breastfeedings. Kama umezoea energy drink, iko na very high caffeine content, utalewesha huyu mtoto. Ataanza kuwa, waisikia mtoto wa 1 week ako na headache. Mtoto atakuwa anashikashika kichwa. Jokes by the way. But we've addressed what the elephant in the room, what people don't address. Happy breastfeeding week. Endeleeni kunyonyesha. Dr. Octo, Reality of Healthcare. Ebu subscribe, like, share and reshare. Comment hapo kwa comments.